Hi, I'm Gia Nicolaides. Here's everything you need to know this morning about the coronavirus. It's day 103 of the national lockdown, and South Africa has now breached the 200,000 mark for total infections since the first case was detected in March. A further 111 people have died from the virus, bringing the death toll to 3,310. And the number of recoveries is now over 97,000, which translates to a recovery rate of 47.6%. Northwest MEC for Cooperative Governance and Traditional Affairs, Gordon Kekakilwe, has died after contracting coronavirus. According to a statement, he was admitted to a Vryburg hospital on Sunday and immediately placed on oxygen before he was transferred to a Klerksdorp facility the next day, where he died. Gauteng accounts for 32.5% of all cases and is expected to become the epicentre, catching up fast to the Western Cape, which is currently accounting for 34.5% of all cases. There's still a lot of confusion about whether Gauteng will see another hard lockdown. Last week, the Premier and Health MEC said a return to a hard lockdown was not off the table. Then at the end of last week, the President said there would be no return to a hard lockdown. But yesterday, the National Health Minister said there was the option of locking down hard again if needs be. The Health Minister is concerned, though, that Gauteng's health system will be overwhelmed by a sudden surge. Zweli Mkhize has once again tried to prepare South Africans for the inevitable increase in infection numbers, singling out Gauteng, the Western and Eastern Capes, as well as KwaZulu-Natal as the provinces that will be most profoundly affected. Meanwhile, unions and rights groups in the education sector say that pupils and teachers at schools that lacked COVID-19 essentials should not return to the classroom. On Monday, grades R, 6 and 11 pupils across the country returned to school after spending months at home under lockdown. They've joined grade 7s and 12s who've been back for a month now, but there are still concerns about the virus spreading at schools. Taking a wider look, hundreds of scientists say there's evidence that COVID-19 is airborne and can infect people through smaller particles in the air. They are calling for the World Health Organization to revise recommendations, according to the New York Times. Meanwhile, a study published in the journal Cell suggests there's a new strain of the virus that is more infectious but isn't any more deadly. It's been detected in Europe and is now spreading to the US. Those studying the virus say it's now the dominant form infecting people. For more on the pandemic, go to ewn.co.za/coronavirus and remember to like, share and subscribe to our YouTube channel.